Siamo a Roma per il secondo forum Incyte sulla ricerca scientifica, un appuntamento importante che ha visto riuniti istituzioni, mondo dell'accademia e imprese private, organizzato dall'azienda farmaceutica Incyte per fare il punto proprio sullo stato dell'arte della ricerca nel nostro paese. Qui abbiamo avuto l'opportunità di parlare con Pablo Cagnoni, a capo della ricerca mondiale di Incyte. Dottor Cagnoni, ci può dare una overview dell'impegno di Incyte nella ricerca, anche con qualche numero? Quanti siete, quante persone sono coinvolte, quanto investe Incyte ogni anno nella ricerca e quali sono le principali aree in cui siete coinvolti?
Certainly. At Incyte, we focus on 4 therapeutic areas. So we have efforts in oncology, we have efforts in hematology, particularly myeloproliferative neoplasms. We have efforts in dermatology and inflammation, and we have an important effort in graft-versus-host disease. Overall, approximately 1,200 people at Incyte focus on R&D. We spend 42% of our revenues in R&D, which is approximately $1.7 billion a year in R&D. And about 25% of our R&D efforts are in Europe currently. We have about 100 ongoing clinical trials, and in 2024 alone, we have enrolled more than 7,000 subjects in those clinical trials.
Un impegno molto consistente. Allora vediamo rapidamente le singole aree terapeutiche. Incominciamo dalla dermatologia. Cosa bolle in pentola? Quali sono i farmaci che state sviluppando? Le nuove indicazioni per i farmaci che già avete?
Our most important effort currently in dermatology is Opzelura. It's a topical treatment that we have developed and is the first treatment ever developed to repigment the skin of patients with vitiligo. Vitiligo is an autoimmune disease in which the cells that make the pigment in the skin are killed by the immune system. Opzelura has been shown now to repigment patients with vitiligo, and that is a breakthrough for the treatment of patients with that disease. We are in the process of launching Opzelura in Italy and in other countries around Europe.
And there are other drugs in dermatology you are developing?
We have an extensive pipeline in dermatology. We have a medicine called povorcitinib, which is a JAK1 inhibitor that were developed for a number of dermatological diseases, including vitiligo, hidradenitis suppurativa, and prurigo nodularis.
Spostiamoci all'oncologia. Qual è la situazione e soprattutto cosa state sviluppando di nuovo?
We have an extensive pipeline in oncology. Currently, we have approved medicines for patients with blood cancers, a medicine called Minjuvi for patients with lymphoma, and a medicine called pemigatinib for patients with a cancer of the biliary tract. We are developing novel medicines to treat other types of cancer, specifically a KRAS inhibitor and a TGF-beta by PD-1 antibody, also to treat a range of solid tumors.
Spostiamoci invece all'ematologia. Qual è il vostro impegno presente e cosa bolle in pentola anche qui?
We were the company that basically redefined how patients with myelofibrosis and polycythemia vera are treated. Now we're developing a new types of medicines for patients with those diseases with an attempt to cure myelofibrosis and polycythemia vera, and those medicines are being tested now in clinical trials in the US and in Europe.
Poi c'è una patologia molto particolare, una patologia da rigetto rispetto all'organo trapiantato, la GVHD, la Graft versus Host Disease. E qui qual è il vostro impegno?
Very recently in the US, we approved another medicine to treat patients with graft versus host disease called Niktimvo or axatilimab, which we're now conducting clinical trials to approve it in Europe as well.
Ecco, veniamo invece all'Italia, che è il nostro paese, e qual è l'impegno di Incyte nella ricerca, ovviamente nella ricerca clinica?
Italy is a very important partner for us at Incyte, in not only to make our medicines available to patients in Italy, but also to conduct clinical research in Italy. This year so far, we've enrolled more than 100 patients in clinical trials in Italy. Italy is one of our leading countries in Europe for clinical trials.